Nodular panniculitis is a skin condition where small, firm lumps called nodules form under the surface of the skin. These nodules are made of inflamed fatty tissue and are usually felt on the legs, arms, or trunk. Think of it like getting a tiny, tender bean under your skin that you can press and feel, but it is not a bug bite or a cyst. The exact cause of nodular panniculitis is often unknown, but doctors have linked it to several triggers. Infections such as hepatitis B or C. Autoimmune diseases where the body attacks its own tissues, for example lupus. Certain medicines, especially some antibiotics or cholesterol-lowering drugs. Trauma or repeated pressure on an area, like tight shoes. These factors can set off an immune response that inflames the fat layer under the skin. People with nodular panniculitis usually notice small, round lumps that feel hard when you press them. The lumps may become red, warm, or tender, kind of like a bruise that hurts more when you touch it. Fever, fatigue, or joint aches may appear if the inflammation spreads. The nodules can disappear on their own, but often leave a pale, indented scar. Example, imagine pressing a grape under your palm, firm and painful. That's similar to how the nodules feel. Doctors diagnose nodular panniculitis by taking a medical history and checking for recent infections, medicines, or injuries, doing a skin exam and feeling the nodules, ordering a blood test to look for inflammation markers or underlying infections, performing a small skin biopsy, removing a tiny piece of the nodule for microscope study to confirm the type of inflammation. Treatment focuses on reducing inflammation and addressing any cause. Corticosteroid creams or oral pills to calm the immune response. Anti-inflammatory drugs, NSAIDs, for pain relief. Treating the underlying infection or stopping a culprit medication. In severe cases, doctors may use immune-modulating drugs like hydroxychloroquine. A practical tip, if a lump feels hot and sore, applying a cool compress for 10 to 15 minutes can temporarily ease discomfort while you arrange a doctor visit. Because the exact trigger isn't always known, true prevention is hard, but you can lower the risk by keeping infections under control, get vaccinated for hepatitis, and treat any viral illness promptly. Avoiding unnecessary or long-term use of medications that may cause skin reactions. Wearing comfortable clothing and shoes to reduce repeated pressure on your skin. Maintaining a healthy weight and balanced diet, which can help keep the fatty tissue under the skin healthy. Think of it like caring for a garden, regular watering, good health habits, and removing weeds, infections keep the soil, your skin, from getting inflamed. The role of specific immune pathways like TNF-alpha and IL-6 signals that drive the inflammation in panniculitis. Targeting these pathways with newer biologic drugs, such as adalimumab, has shown promise in small clinical trials. Genetic studies suggest a few people carry variants in the CTLA4 gene that may make them more prone to autoimmune panniculitis. Imaging advances, such as high-resolution ultrasound, can now visualize the depth and size of nodules without a biopsy, helping doctors decide when a biopsy is truly needed. These advances mean that in the near future treatment may become more personalized, using a blood test or scan to pick the right medication faster.